Welcome back, everybody. Today I'm going to be talking about xylazine, which is a veterinary tranquilizer, also known as Tranq or Tranq dope, which in the past 2 to 3 years has become more and more prevalent in the U.S. illicit opioid supply. This is a chemical that was first mixed into recreational drugs starting in Puerto Rico in the early 2000s. About 2015 or so, we started seeing it mixed into the U.S. fentanyl supply, and in some parts of the U.S., it is in as much as 42% of samples of illicit opioids that are confiscated right now. So this is more and more prevalent. It started out as an East Coast thing, and it is spreading all over the U.S. right now at sort of an alarming rate. So I'm going to tell you some fast facts about the chemistry, action, and harm reduction tips regarding xylazine. If you don't know me, my name is Brian, also known as the Neuromancer or Neuromantic here on YouTube. I run an addiction and recovery blog called the Concrete Confessional blog, and I am someone who has been in and out of addiction and recovery for 15 plus years at this point. I've been addicted to benzos and opioids, and at the present time, I am tapering off of methadone maintenance. So I also want to let you guys know I kind of went unexpectedly semi-viral when I published my video about Mark Lada's Soft White Underbelly project earlier this week. I want to give you guys an update on that, and I want to give you guys an update on a cease and desist that I received. Now, I'm not going to be one of those YouTubers who teases something deceptively. It is not a cease and desist from Mark Lada. Fingers crossed, hoping that doesn't happen, which it shouldn't, because everything I said was completely qualified and covered by my right to express an opinion on YouTube. But I did get a cease and desist this past week from another person who I made a video and then a piece on my blog about, and want to tell you guys a little bit about that. So I'm going to save that stuff for the end because I want to have the xylazine content front and center here. I've had some of you ask a little bit more about my background. If you're wondering more about my story, there is one of the first, I think, 2 videos on my channel is called something like Science Teacher / Opioid Addict Tells All. The lighting is awful. It was like the first video I ever made, and it was in my mom's basement, but it's just a really honest, just straightforward talking in the camera like it's a friend kind of description of the chaos and beauty and struggle of my life over the past, whatever, it's been 36 years. So if you're wondering more about my past, that's the best video to go to for sort of a comprehensive introduction about how I got to where I am now and where exactly I am right now. So without further ado, I'm going to get into my fast facts about xylazine. So fast fact number 1 is that xylazine is a veterinary tranquilizer. It was originally tested for use in humans, and it was not pursued for clinical use because of a really high incidence of bad side effects. People's heart was slowed to an extent that was deemed dangerous, and in addition, there were some really interesting early reports of psychological confusion, more so than you see even with other standard anesthetic agents. So xylazine is a veterinary tranquilizer. In terms of its chemical class, it's closest to what we call the phenolphthaleins. Okay, so these are chemicals that have what we call like a tricyclic ring structure. So when we talk about rings in organic chemistry, we are talking about sort of pentagon or hexagon shaped molecules that typically have carbon atoms kind of at the corner. Now, in the case of xylazine, that structure is a little bit broken up, and in addition to carbon atoms, you've also got a sulfur atom and a couple of nitrogen atoms. So in terms of its closest chemical relatives that have human significance, it's related to tricyclic antidepressants. It's quite similar to a chemical known as thorazine, whose chemical name is chlorpromazine. You might know about chlorpromazine. It is famously, if you're on the psych ward, you're having a bad day, and you just want to kind of let time drift by for the next 24 hours, you might stage a little bit of a freak out, have a little one flew over the cuckoo's nest moment, and they will give you a shot, usually in the butt, and that is thorazine. So it's one of those classic antipsychotics, and xylazine has a lot of chemical similarity to thorazine. However, in terms of assessing the structural similarities, it is most common or most similar of all to clonidine. Now, clonidine is what's called an alpha adrenergic agonist. It means it works at the adrenaline receptors of a certain type in your body, and clonidine was actually developed as a blood pressure medicine. It doesn't work so well for that because it's got a lot of side effects and it can be very dangerous if you suddenly stop it because you get rebound hypertension, really bad high blood pressure that can cause a cardiac event. So put a pin on that. But what's really interesting about clonidine is, again, it's developed as a blood pressure medication, but it is used all the time for opioid withdrawal, because in opioid withdrawal, you get this surge of adrenaline. Because of that, you get anxiety, you get high blood pressure. It contributes to this awful restlessness, and so clonidine is used to treat that. It's really effective, especially considering that it's not a controlled substance. And it's no coincidence that we've now got this chemical called Tranq or Xylazine, which is very similar in the drug supply. It's almost like they're taking the drug to treat opioid withdrawal and incorporating it into the illicit opioids that you're buying on the street. So in the US, again, xylazine is increasingly found alone, but almost always still it's found with fentanyl. So it's almost like they're giving the drug to treat fentanyl withdrawal along with the fentanyl, which is brilliant in a kind of really sick way. But before I digress too much, again, it is used in modern veterinary practice, so it's used particularly on horses, but I did find some reports of it being used on rabbits and other animals. Produces everything you would think of when you think of an anesthetic: lowered consciousness and sedation, slower heart rate, muscular relaxation, decreased pain response. When I was looking into the clinical literature, I found a really funny line that I wanted to mark out for you guys. So this is from some kind of veterinary manual that's telling veterinarians what to know about xylazine relative to other anesthetics. And it says, "It is wise to remember that xylazine or medetomidine alone may result in a deceptively sleepy patient that can still kick accurately." So they're talking about quote unquote mares in that little excerpt. Probably could apply to humans depending on the mental state and what kind of social intervention is being performed on the people who are on and coming off of this drug. So I just found that kind of darkly humorous. Again, it was tested for use in humans, and it was not pursued clinically because it was seen as so unsuitable. So that says a lot right there, because think of how many medications we have, particularly ones that are used during surgery, with awful side effect profiles. So kind of a high bar for them to just say, like, okay, yes, this works as an anesthetic, but we're not going to pursue it. So that's sort of the history of this chemical and its chemical characteristics. Again, it's a phenothiazine with similarity to tricyclic antidepressants, the atypical antipsychotic thorazine, and also the alpha adrenergic blood pressure agent clonidine. Okay, so fast fact number 2 is that xylazine boosts the effects of fentanyl when it's included in this so-called Tranq dope. So on its own, this stuff is garbage. I actually have a trip report. I have a weird history with xylazine. So when I was an undergrad and I was taking some upper level animal physiology seminars in the vet school of the university that I went to, started getting access to, clinical context in a big veterinary hospital. So I'm walking back from one of those labs one day and I see these pens where they're holding horses prior to surgeries and births and things like that. And I see just abandoned there this vial, and I see some of the markings on it that make me think it's something that is being used surgically, and I'm thinking maybe it's ketamine. Okay, so I had never done ketamine at that point. In fact, to tell you the truth, I've never done ketamine to this point, but I'm thinking, okay, it's a veterinary tranquilizer. Maybe it's something like ketamine. They're not using it. They're probably going to dispose of it because obviously the horse has come and gone and this vial has been discarded here. So I actually grabbed it, found out that it was xylazine. This is 2010, mind you. So this is years before anyone in the US even knows that this thing exists outside of Puerto Rico. So bring it back to my apartment, and I'll make a separate video about this if you guys want, but I look up the dosage. So it's a liquid, like I said, so I have to inject this. I look up the milligram per kilogram dosage recommendations for different levels of sedation and anesthesia in different animals. I'm trying to extrapolate from that which dosage levels might be fun or at least safe in a human being, which is an incredibly reckless thing that I would never do today and that no one else should ever attempt to do. And I end up having 3 little experiments with xylazine. And when I tell you guys, this stuff is complete garbage. Like, you take a little bit, basically not even any noticeable effect. You get some weird little peripheral effects, feel a little bit off. You take more than that and you start to get this sedated feeling. It's not the pleasant sedation of something like any opioid drug or even something like propofol or a benzo, not anywhere near that. This is much more that gross, like vibratory feeling that you get if you take like a crap load of like Benadryl or something like that. Really uncomfortable feeling. Then when I finally cranked up the dosage enough, because I'm like, this stuff is garbage, I feel no euphoria, I feel no pleasant sedation, so I took a little bit more. Boom, I'm out. I wake up on the floor of my apartment, the needle is right next to me, and it's like, it was just garbage. So this stuff on its own is not worth using, but it's included in with the Tranq dope with fentanyl because it boosts the effects. Just like antihistamines and a lot of other chemicals that have slightly sedative properties on their own, when you include them with the fentanyl, there's kind of an additive or a synergistic effect where both chemicals complement each other, and it seems to make it feel like fentanyl, which wears off extremely quickly relative to other opioids. It makes it seem like it's lasting a little bit longer. And again, I think it's built in because it's sort of like when you're going through fentanyl withdrawal, instead of just having your doctor or something give you clonidine, they're sort of putting something very similar to clonidine right in the formulation of the illegal street drug that you're taking to give you a little buffer so that you are not so sick so quickly. And by the way, they're not doing this out of the goodness of their hearts, the dealers who are masterminding this, by the way. They're doing this so you don't get so sick so that you can't go out and get money and keep your habit going. Because if you get people too sick too quickly, they tend to get into treatment and get better. So this is just a very sociopathic way to make sure that you stay addicted. So yeah, fast fact 2 is that it's there because it increases the sedation, probably the euphoria, and some of the other effects of fentanyl and other opioids. So again, in the US, even as Tranq is becoming more common on its own, it's usually found in combination with fentanyl. Okay, so fast fact 3 is xylazine seriously increases your chance of having an overdose, and if you have that overdose, of it being a really severe event. So it comes from what I just said with fast fact 2, it boosts the effects. Well, the effects include slowed heart rate, they include unconsciousness, I don't know why I'm laughing, I'm a sick freak, I guess, but they include nervous laugh. They include unconsciousness, they include low blood pressure. So you see that when xylazine enters the illicit opioid supply in any area in the US, the number of serious overdoses go up. And in fact, the local public health officials typically learn about it because there's this rash of really severe overdoses, and they don't look like typical opioid overdoses. What do I mean when I say that? I mean with a typical opioid overdose, including a fentanyl overdose, you give an opioid antagonist, something that kind of reverses the effects of the opioid drugs in your brain. This opioid antagonist is called Narcan or naloxone, which many of you are probably familiar with. And so that is pretty effective usually if you're just on opioids. That's pretty effective, really effective actually, at reversing the overdose. However, if you've got Tranq on board too, what they're seeing is that you still should give the Narcan because you still need to reverse whatever component of the overdose is coming from fentanyl, but there is no reversal agent for xylazine that we're aware of. So people might be given the Narcan and they might not come out of it like they usually do. So there are a lot more of these overdoses that are, first of all, fatal, but in addition to being fatal, that are requiring ICU intervention, that are requiring long-term hospital stays with ventilation. This is some really dangerous, nasty stuff. Like if you are still using street opioids in the US, there has never been a more dangerous time or a better time to get out. And I'll talk to that point a little bit more in a couple minutes with my harm reduction tips around the emergence of Tranq. Now, the next thing I want to talk about, and probably the most notable thing about sort of in the media coverage about this chemical, is that it causes awful skin sores. So the way that this happens is it constricts the blood vessels that are close to the surface of your skin. Let's put it that way. So especially if you've got diabetes, if you're a smoker, if maybe you got high blood pressure, but it could happen to anyone. When you start using Tranq within 24 to 48 hours, again, if you're susceptible to this effect and you use it regularly, you end up getting these lesions. And I have a picture, I can't include it on YouTube, but my friend Mike has a great example of what these look like when they first show up on your body. Oftentimes they're on your arms and legs. They're these tiny little like penny or pea-sized sort of irregularly shaped lesions. They look almost like some kind of allergic reaction to me, and they are present, like I said, arms, legs, elsewhere on the body. And as you keep using the Tranq, your skin oxygen deficit gets more and more. So your skin is like more and more hungry for everything, all the fuel it needs, the glucose, the oxygen that comes with your blood. And so these sores develop really quickly. So I can't describe this super graphically here, and I don't necessarily want to, but this Tranq dope, I mean, it causes awful lesions that are very like reminiscent, if you saw maybe the Vice coverage about crocodile, about desomorphine in Russia, it's very similar to that. These are the worst cases of open sores and gangrene that I've seen in any medical demographic, including diabetics in the US. It is awful. People are literally walking around with their bones out. So what we see from public health data all over the US is that, as I said, when Tranq shows up in your area, oftentimes you find out about it by maybe a dozen or maybe 20 really severe overdoses that seem to have something involved that's a respiratory depressant and a cardiac depressant that is not just fentanyl or another opioid. But what you also see is that you get an increase in amputation rate. I mean, this is gory, grisly stuff. It's stuff that you don't expect to see in the first world. It's stuff that our doctors and nurses are still learning how to respond to. Basically, the only thing that they can do is give you antibiotics so you don't develop bacterial infections in these wounds, which you will. When these wounds become severe, like, not even just severe, moderately severe, they will get infected. And if you don't stop using, they can give you drugs to, antibiotics to try to limit that, but it's just sort of mitigating it. It's nothing will reverse it except, ceasing use of Tranq. So what you see is a lot of people are getting amputations. A lot of people are getting septic, meaning the bacteria from these sores go into their bloodstream, into all of their organ systems, and they can die. And this comes from this constriction, this making smaller of the blood vessels near the surface of your skin, which comes from the effect on those adrenaline receptors that I talked about before. So different drugs that work on those receptors have different balances of effects in terms of how they affect like your bigger blood vessels deeper down in your body versus your peripheral blood vessels closer to the surface. And the balance of these effects with xylazine seems to be incredibly good at initiating these awful sores. And I've read several clinical studies about how they're managing these sores at different levels of severity, including one from, I think it was the Philadelphia doctors group for orthopedic surgeons, and they're still figuring it out. I mean, I'll talk about this a little bit later, but people with these sores are having an awful time even getting into detox, because the detox units won't take them because they're classified as medically severe, and the hospitals don't want to take them because they're incredibly high risk. They don't know how to manage xylazine withdrawal. We have no idea what to do about it. It seems to involve kind of a mix of what I would call typical opioid withdrawal effects that hit a little bit later than expected on the typical timeline, as well as benzo withdrawal-like effects. So people who have been through this Tranq dope withdrawal say that it is awful, that it's worse in many of their experience from just typical fentanyl withdrawal, which in itself is just one of the worst experiences on earth, frankly. So people are having trouble getting treatment because the hospitals just say, until you stop using, we can't really help you. So we'll take you in, we'll debride the wounds, we'll clean them up, we'll give you antibiotics, but we're not going to admit you and we're not going to detox you here. These people also can't go to detox wards because they're too high risk because they have major medical problems in the form of these sores. People are dying probably because they can't get treatment for these things. And I have a little bit of a strategy to counteract that, and I might present that in a later video if anyone is interested in how, if you know someone in this situation, I think they could present themselves medically to try to increase the chance that they'll be admitted inpatient at the hospital and detox there if they need it. Okay, so that is the final fact, is that, if you want to look at these sores, I don't recommend it if you don't have a really strong stomach, but just Google xylazine Tranq sores. And again, people just have their bones out. And this is not some 1 in 1 billion, person who had a lot of medical comorbidities who ended up like that and being the case study of the century. This is like we have hundreds of these patients with these severe lesions at this point, which have required amputation. So, okay. think I ran through everything that I wanted to say. Again, today is fast facts. I have a video coming up about my own experience with this, reading some Reddit posts about experiences that people have had with going through using this Tranq dope, and also with withdrawing from it. So this Tranq dope became famous initially on the East Coast, especially in the Kensington area of Philadelphia. But again, it is spreading. It's increasing really alarmingly rapidly in the South, and we're even starting to see it in the Midwest and West too. I have been monitoring the DEA data about what's showing up in our illicit opioid supply for years from my blog, and I will continue to do that and update on everyone on the general patterns of where this stuff is showing up, and what we can do about it as we learn more about it. So I wanted to talk briefly about harm reduction. So again, there has never been a more important time to stop using illicit opioids if you're using them now. Please, if you can't just stop using, if you can't go through detox and get off of everything, which most opioid addicts cannot, the failure rates are like 95% plus. If you're talking about short-term detox and then, trying to get completely off of opioids and other addictive drugs. So try to get on methadone or buprenorphine, which is also known as Suboxone, Subsolv, Sublocade. We have gotten so much better at getting people quickly into these opioid maintenance programs in the US. Yes, it depends on where in the US you are, but when I was in my 20s dying of addiction, severe overdoses, bad other medical complications, hepatitis C, there was a 6-month waiting list for one of the only methadone clinics in my hometown. Actually, it was the only methadone clinic at the time. There are now 3. You can show up without insurance and they will get you in and started within 2 to 3 days. So Suboxone, which has less restrictions on it, or buprenorphine I should say, is even more widely prescribed. So I'm not sure how much of these resources I can share on YouTube, but on my blog, which is completely not monetized, as my YouTube it is not monetized as well, I do have a list. There's an article called Tranq Fast Facts, and at the bottom of that I have a list of sort of search engines that you can use to find treatment providers of different types. There's also a 12-step meeting locator, I think a smart recovery meeting locator. So if you're not sure where to start, that might be an okay resource, or I'll try to help you out in the comments. Okay, so we do harm reduction because most people who are using drugs don't necessarily need to stop right now. If they do need to stop, they probably don't realize it. And even if they realize it, they probably aren't able or willing to yet. So one of the things you can do is just figure out whether this is actually in what you're using. There are test strips available for free. So for example, if you're in New York State, we have OASIS. It's the Office of Addiction Supports and Services. They will mail you test strips, okay? So at least you can inform yourself and your doctor for sure, and whoever is around you who might be dealing with an overdose, that you have Tranq in the supply that you're using. Although guys, if that test strip comes up positive, again, this is garbage stuff. It's not euphoric. Get yourself into maintenance, please, okay? So you can get test strips. If you're not sure how to do that where you are, again, hit up the comments and I can help you with that. That's just a general public health thing. It's not me playing doctor. Anyone is well qualified to do that. So we can share public health resources together. That's important. All right, so use the test strips, get on opioid maintenance, and if you are using illicit opioids, whether you know that it's Tranq or not for sure, and you get any kind of sore anywhere on your body, you need to go to your doctor immediately, and they'll probably start you on a broad spectrum antibiotic, which can at least decrease the risk that this is going to go to a potentially fatal infection. One more thing that I should have said before that I want to mention about these sores. There's a perception that these sores are related to route of administration, meaning that they only happen to people, for example, who inject this drug, where they inject it. Not true. You can snort it and get these lesions. They appear all over your body, not just local to where you're taking it into your body, and it doesn't matter how you're taking it in, okay? So wanted to mention that as well. If you see sores anywhere on your body, you need to get to an emergency room or a doctor and make sure that you're taking appropriate precautions against progressing to sepsis or to widespread sores that are infected. And even if you live through that, that is one of the most awful medical experiences you can go through. You're likely to be scarred for life. You're probably going to need grafts if these skin lesions get bad enough. So please really take care of yourself and get to the doctor sooner rather than later. You show up to the emergency department with a risk of sepsis in the US, they have to treat you. It's potentially lethal, they can't turn you away even if you don't have insurance. So in general, that's the case. Not saying a hospital has never made a shady decision to deny treatment to someone who they probably had to cover treatment for. But in general, in my experience in the US, hospitals, doctors, and nurses are pretty ethical about that. There are a lot of penalties if they're caught not adhering to that emergency treatment rule. And yeah, get yourself to treatment if you need it. I have this very goofy saying I say carpe diem before there isn't any diem left to carpe, and this has never been so true. Like this time now with Tranq reminds me of when in sort of the mid to late 2010s fentanyl really started hitting the US opioid supply. Our systems weren't used to it, our dealers didn't know how to cut it, and people were dropping dead left and right. It was unbelievable how many friends I lost in the space of 2 to 3 years. So Tranq is sort of like a fever dream of that period that's even worse because of this like these awful skin lesions and amputations. Like almost seems like some kind of like biblical punishment or something, which some people might believe that that's the case. Okay, so that is what I want to cover about Tranq for today. If you want any follow-up content, I have some planned, again, including some content that includes Reddit posts, including some content that describes in more detail my own experience in that experimentation phase with Xylazine that I got as an undergrad from a veterinary supply, as well as when I relapsed after coming back to the US from mainland China. I used Tranq dope in Syracuse. Again, 0 stars on Yelp. Would not recommend it to a single human being. Garbage in terms of recreational value, and yeah, I would like to talk more about that. All right, so if you were here for Xylazine and you don't want to hear anything else, just click off, and thank you for coming. I hope to see you again. If you are staying on for a couple of quick updates, thank you for hanging out with me for a minute. So I made a post, as many of you probably know, just sharing my thoughts about Soft White Underbelly, which had been simmering for so long. Made that post a few days ago, and it got unbelievable traction. I just started a post to YouTube like a few weeks ago. It's been under 2 months. You know, I've only made a few full-length videos, and I had like, I think 80 or 90 subs when I posted that video, and it ended up getting 100,000 plus views. I ended up getting 3,000 subscribers. Like, I didn't think I would have even 1,000 subscribers in the first year. So first of all, thank you, all of you. I've shared that I'm going through methadone withdrawal right now. I'm going through it quickly because I kind of need to be sick while I can afford to work less over the summer in certain senses. So I know I really thought I was going to get made fun of a lot for misspeaking, for just sort of spacing out, and for obviously having something going on in terms of, some detox effects. But people were incredibly kind about that. I got literally dozens and dozens of messages from people, both in the comments and DMs of different sorts, from people going through similar experiences. So my goal with this social media, my blog presence and my YouTube presence over the past couple of years has always been to build a community. I don't particularly care about high sub counts, about like high views. Obviously those are great for exposure, but like I want to develop a community for people who are not just going through addiction recovery, but who are going through other mental health concerns, or who are just having like life throws crap at them and who need an outlet. So I can't tell you what it meant to you guys, to me rather, that you guys did that. Like, I think there's probably not a more honestly grateful YouTuber in the history of YouTube, because I needed that. And I'm not gonna lie, I'm too old to get too excited by that, but when I saw that like it was literally getting thousands of views, and like these comments were building up, like stacking on each other so quickly, it was almost like a high for a few hours. It was like, holy, like it was totally out of proportion to anything I expected, and I can't tell you guys how much it means to me. I told my brother, like, you talk about that parasocial relationship that's discussed all the time in media and psychology these days, and it's basically like when fans think that some content creator, that they know them better than they do, that they have some kind of meaningful personal relationship. And told my brother, now I feel like I have the opposite of that, like the reverse parasocial effect, where I feel like I made a bunch of new friends, and like this stuff is going on in my life, and like I'm excited to share it. Had something really bizarre happen while I was walking to the methadone clinic very early in the morning in my hometown. I'd probably make a short video about that because it was so surreal and strange, but for the first time in my life I have that happening. It was actually something kind of scary, and I thought like I should take my phone out and possibly record this, because like this is unbelievable. I had that same feeling that I would want to like share something crazy that happened or interesting that happened with a friend. So thank you all, and please let me know, for those of you who have subbed and who intend to stick around, what do you want? Like, do we want to try to go in the Discord or group chat direction? Do we want to do hangout live streams? You know, I just let me know what kinds of videos, what kinds of content you're looking for, why you're showing up. Quick note, I know like I need to make my videos more visually interesting. I did download a free version of a video editing program, and I'm not ready to spend like $400 on that software right now. In fact, that would be like financially irresponsible of me. So, you know, I gotta see what's out there at different price ranges, but I am learning video editing skills, and I'm also trying to improve my sort of like, I don't know what you can call it, not public speaking, but my, you know, I guess, I don't, you guys know what I mean. I'm trying to get better at talking to a camera like a weirdo alone in my apartment. So anyway, I'm trying to do that, and I appreciate the grace. I do really want to make these videos as good and as impactful and as, you know, something that will hold your attention. And I appreciate that you guys realize that I'm like early on in this arc of learning about that. So thank you, like genuinely thank you so much. And final note, I got a cease and desist. Again, it was not from Mark Leda. I made a video and I wrote a blog piece about a treatment provider down in Florida who is doing incredibly shady advertising, telling people that they'll, after this opioid detox under anesthesia procedure, which is not covered by insurance, in which the medical evidence on, to my understanding, is extremely unfavorable about. Their website is advertising return to the life before opioid addiction in as little as 48 hours, wake up without cravings or withdrawal. Blatant lies. And this guy has operated similar clinics. He was educated in Brazil. He's operated similar clinics in Israel. I believe he was involved in one in Spain. One of the most prestigious medical journals in the world, Lancet. So after I published this article, someone who had worked with him reached out to me, said, hey, check out this Lancet article from, you know, a while ago, 15, 20 years ago. This guy was called out in this prestigious medical journal. What do I read? Oh, for using extremely deceptive advertising about rapid opioid detox under anesthesia. Oh, go figure. Oh, you come to the U.S. and, you know, decide to open a clinic in Florida where you're not even licensed to practice. I learned from this cease and desist. Thank you for telling me that, law firm. And, you know, you are taking advantage of one of those medically deregulated states, which gave us the OxyContin epidemic. The pill mills there are hugely responsible for today's opioid epidemic, because all those people a lot of them ended up going on to heroin, now fentanyl, now Tranq, okay? It also gave us the Florida shuffle when all of these very unsavory for-profit treatment centers opened in like the late aughts to the early to mid 2010s. They got these patients, they would fly them in for treatment, and patients would get trapped in this cycle of like intermittent homelessness. These addiction treatment providers and detox services were so sketchy, they would pay people to relapse so that their insurance company would then allow another round of treatment. So look up Florida Shuffle. I'm going to make a video about that too, but other people have covered that pretty well. So all I can really do is share my own experience and talk about how it's continuing today in different forms, especially through Medicaid. It was originally a private insurance thing, and now it's happening with Medicaid in California and some other states. So I do want to make a video about that, but you can find a lot of content about that on YouTube. So anyway, this guy is taking advantage of that deregulated environment. He is a foreign medical graduate who is using, his clinic is using what I consider incredibly deceptive advertising, sent me a very strongly worded cease and desist that is absolute BS. I have, my mom is a lawyer, just kind of, just middle class lawyer. I have other lawyers in my family. I have two cousins and an uncle who's a lawyer. I have one of my good friends from undergrad who's a fairly high-powered lawyer she's not a defamation attorney, but she works in an adjacent area of law, and she provided me some incredibly useful advice that I would like to share. Although I can't give specific legal advice and I have no legal background, I want to share what she told me because I think it would be helpful for other YouTubers who get so scared by these cease and desist notices that have no constitutional basis. I was reviewing information that they put out there with an appropriately qualified opinion about my own background, about my own extent of interaction with them, although I do have some information from the inside that these people don't know about. So that will be wonderful. If they are foolish enough to lean into the Streisand effect and take this into court, I will love to share what people who have actually been associated with this shady operation have to say about it. So anyway, I'm going to make a video about that because why not? They're trying to impinge upon my constitutionally protected right to, give my opinion. They're using lawfare, which is financially abusive, particularly when you are filing a bullshit lawsuit against an addict who has medical debt and other forms of sort of, almost like financial disempowerment to contend with. Your average substance abuse person with a drug problem is not able to pony up 80,000 to 150,000 lawyers like your average doctor, or 80,000 to 100. I'm getting heated and I can't talk anymore. Sorry, $80,000 to $150,000, to lawyers to defend themselves in court. But this isn't going to go to court, and if it does, it is going to be glorious. So I'll update you guys all on that. I think that will be my very next video. I'm good. I'm not worried about that. I'm not sweating it. I will read part of the cease and desist. It was very bombastic. It was very bloated. They misspelled a lot. They said they wanted me to know they trademarked neuroregulation. I said, what's neuroregulation? Is that another one of these bullshit pseudoscientific concepts that you guys are peddling? Like, I've never heard of neuroregulation. I don't know where these lawyers went to school, but where I went to school, if you're getting paid hundreds of dollars an hour, probably by your client to write a cease and desist, you should probably put it through the old spell check before you submit it. But all right, I'm done being a jerk for today. Thank you all so much for listening. Thank you for watching my video about Soft White Underbelly, and please hang around. Let's go through this crazy thing called life together. See you.